ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਤੇ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਜੀ ਆਇਆਂ ਨੂੰ। ਮੇਰਾ ਨਾਮ ਹੈ ਹਰਲੀਨ ਚੌਹਾਨ ਤੇ ਤੁਸੀਂ ਮੈਨੂੰ ਪਹਿਲਾਂ ਦੇਖਿਆ ਹੋ ਸਕਦਾ ਹੈ, ਪਰ ਅੱਜ ਮੈਂ ਤੁਹਾਡੀ ਮੇਜ਼ਬਾਨ ਹੋਵਾਂਗੀ। ਅੱਜ ਦਾ ਸਾਡਾ ਪ੍ਰੋਗਰਾਮ ਹੈਗਾ ਤੁਹਾਡਾ ਸਿਹਤਮੰਦ ਬੁਢਾਪਾ ਤੇ ਉਸ
And we'll talk about that. So, before going forward, we'd like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, and Tesla peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of these lands. As I told you, I'm your host, Harleen Chauhan. I'm a pharmacist. And let me tell you about digital medication. What does it iCON mean? It means intercultural. We are associated with the University of Digital Emergency Medicine. What is our purpose? To assist multicultural and indigenous citizens, patients, and caregivers, and the community at large about chronic diseases, to help them. And if you're living with somebody who does have chronic diseases, we can help you with that, how to take care of them. We also want to tell you, in the age of internet today, that what you're reading there in news or on YouTube, that all that information, how you should look at it, does it belong to you or not, and you should trust it or not, and what things you should not trust. And last of, we want to tell you that about our healthcare providers, the people who provide you healthcare, and yourself, how to have a good communication between them and how to improve it. And that's example today. And we are here, your caretakers are your speakers today, and you can ask them questions. We will start today with our opening remarks.
Thank you for the opportunity to provide opening remarks at today's Strengthening Health and Wellness as We Age forum. I'm Lindsay Arscott, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health, and I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with this land continue to this day. The Ministry of Health's Patients as Partners initiative believes that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but it is an effective way to make the health system better and the people of BC healthier. This philosophy is summarized by our motto, "Nothing about me without me." Patients as Partners has collaborated with and funded iCON for about 15 years with Dr. Kendall Ho as the executive director for all of this time. iCON continues to bring healthcare providers together to speak with people in their first languages about topics they want to learn more about. And today, that is about how we can stay resilient and as healthy as possible as we age. As we age, the risk of being frail increases. However, getting older and frailty are not the same thing. By taking a holistic approach to health, you can stay healthier longer. For example, Cardiac BC states that about 90% of premature heart disease can be prevented with good health practices. Additionally, a recent study by the U.S. Centers for Disease Control and Prevention found that the evidence demonstrates that the strategy of self-management and educating ourselves achieves desired outcomes in multiple chronic disease contexts, including diseases of the cardiovascular system, diabetes, asthma, and arthritis. So there's lots that we can do. I want to thank iCON for bringing us together today, and I invite you to check out the resources after this discussion. You will find information on self-management, eating well, staying active, building resilience, and many other topics. There are websites where you can enroll in self-management, health coaching, and other peer support programs that provide information, skills, and support to help you achieve your health goals. Some of these resources and programs are provided in different languages to make them more accessible. Also remember that encouragement and support from working together as a family and in the community can make it easier to make these health changes. I want to express a big thank you to iCON and our presenters. I appreciate your time. I want to thank everyone for attending. What you do for your health can make a big difference. Thank you. Have a great session.
This was from the Ministry of Health, a couple things. The things that she said that I want to bring into your attention that my health is in my hands. Otherwise, there is no health. So what you can do with your health and to decide to make judgments about your health. So I will bring you the first speaker, Dr. Gurmeet Sohi. Gurmeet Sohi, she is a geriatrician and acute care, and she's responsible for acute care for the older people, and she is also providing palliative care. And if you need anything, she takes care of that. She works at the Vancouver General Hospital and St. Paul's Hospital in Vancouver. Gurmeet did her bachelor in kinesiology and biomedical and master of science in pathology and medicine. After that, she started her medical career. She did doctor of medicine degree, and after that she started to take care of the elderly people. She did internal medicine and then another specialty for acute care. She is a clinical instructor in UBC, University of British Columbia, and whatever she is doing, she is working on patient who are in the hospital, how to take care of them. Only not that. So people who are being trained as a doctor, the residents and medicine students, they are providing them education so that they can perform well while they in the future. Her maternal grandparents raised her up, so that's the reason, that's the motive for her to take care of the elderly people, to help the elderly people. And for elderly patients, any concern, any issue, any age-related issues, or while aging, nothing should happen wrong to you. So she's working on that, and she wanted to provide very good care to them for their well-being. I don't know, in her free time she does hike if she has any, painting and reading, and spend time with her family and friends. So please, with all this, welcome Dr. Gurmeet Sohi. Okay. Greetings everyone. Welcome everyone. For next 20 to 25 minutes we will be talking about frailty. Frailty is weakness, impairment, and how we can deal with the frailty. First of all, we will talk about what is frailty and how we can take care of it, how we can take care of things related to it. And when we are frail, how would you know that you are frail? And then after that, after your mental health, how it affects your mental health or impacts your mental health. First of all, the frailty, you can think about it. When you are aging, you are a lot of illnesses. Some, not all, but some people have one illness or another one. When you have lot of illnesses, ailments, then it impacts your body and also your mental health. As you get frail, then your body gets stressed, and it's hard for body to deal with all these cumulative impairments. So these frailty is caused by the sickness or with the as you age. This frailty may involve your muscle loss, decreased energy, cognitive impairment. As I said, it's with the reduced ability to recover from stress, with hard to fight the stress with frailty, and then the overall health outcomes become poor. So I wanted to make it clear, while you age, there are a lot of people that they become frail with aging, but it's not only that. Sometimes people get frail, it keep on increasing, and they will do whatever they can. But some people, if they become frail, we can work together, we can make it less, and we can work together, and we will make sure it impacts your health less. And how we can avoid all this. That means, as I said, what is healthy aging? When we are aging, we want your physical, mental, and social well-being. As you age, for every person, whatever you guys are doing, your lifestyle, you can control how you age. So what are the key steps you can do? First of all, your diet, and then we will talk about activity, and if you want to see the doctor, how you can screen your health, and whatever are the health factors in the community, diabetes, heart disease, blood pressure, how we can improve that, and how we can manage that, how we can strengthen you, how we can keep the environment good, how we can adjust all these things, so that how you can be good, maintain all this. As I told you, when you age, there are a lot of changes. For some people, they are 90-year-old and they are all well enough, and some people are 70 and they are not, they are unwell. So how one thing that affects is genetics. You can't control your genes. That's, you got it from your parents, your family history is gonna be there. You can't avoid it. There are the other things that are in your hands is your lifestyle, the choices you make, and so that will impact your how you age. The lifestyle choices will have a more powerful impact. But genetics, you can't do anything, but with the lifestyle choices we can make a big difference. So there are things change. There are changes when you age. Sometimes you can't hear, then there are vision problems. Some people will have these problems, some won't, but people who have healthy lifestyle, they may slow many things. So who are the people who are at risk for frailty? People who are advanced in age, like people who are 90 and above, that we have concern for them. I hear sometimes people who are only 70, I'm old, I'm frail. People say that, and they are only 70, and I say no. I can see patients who are 80 or 90, 100 year around, who lives alone, and they're pretty well. And I want same thing for every one of us. There is a risk factor. Advanced age is a risk factor, but That's not the only factor. There are other things. If you are taking a lot of medication, is like polypharmacy, it also affects, has an impact on frailty. If you are poor and you are living alone, isolation, it also impacts frailty. And if you have poor nutrition, you are losing weight, it also impacts frailty. If you have more ailments, it also affects frailty.
In next few minutes, we'll talk about how do we know that you are getting weaker. First of all, there are symptoms in the body. The body knows, first of all. Your body weight goes down. Nothing wrong with that. If in a year you lose 10 pounds and you're not attempting to lose weight, you should tell your doctor. Maybe you'll start getting weaker with that. And the next is, controlling your urine. For some people, it is harder and it gets weaker. So you have to take care of that. And some people don't get hungry as much. Loss of appetite, they're not eating as much, so you have to think about that as well. And some people lose their muscles and they're not as strong. And some people say, my thighs are weaker now, smaller, so you should, what we can do about it, you should talk to your doctor. And then osteoporosis, breaking of bones. As I said, and sometimes it's hard to accept. And sometimes people have loss of hearing, vision, and some pain. And once you start getting these weaknesses, you start going to the hospital more often. And then there's a flu season just recently. Some people have flu. They're fine at home. They are able to control the symptoms, but some people are able to go to the hospital. They have to go to the hospital and see a doctor. And those are physical signs. But sometimes, what about your functions? Some people have declining functional status. Mobility goes down. They start falling around and they lose their balance, and they start getting tired, fatigued sooner, and loss of energy, and they don't want to do their day-to-day activities. And whatever they used to do earlier, they can't do it anymore. And we should look after those things as well. Then you know that the patient is getting weaker. And then there's psychological signs and symptoms. You should also take care of those too. Some people have delirium, and some people start forgetting things, and we call it dementia. And when people have dementia, and that can also make you weaker, it goes both ways. If you are weaker, then your memory goes down, and if your memory is weaker, other doctors will explain that. Some people start getting depressed, and they start getting scared, and sometimes their sleep is affected as well. And they are having irrational fears, concerns, and they start feeling different things. And when you have that, you should take care of it, that you're getting weaker. And when we are in younger age, you don't have less effects of these things, medication and other alcohol. As you're getting older, those risks and side effects are getting worse. And once you have started getting weaker, with the medications you're taking, some medications have worse side effects on you. And we can review those medications, which one you really need and which one you need to remove. And some people start drinking more alcohol, and that affects your mental health. It's harder for them. You should look after that as well. Lastly, some people don't want to tell you openly that they are losing weight, that they're depressed, but there are other ways to learn that. People who are being isolated or want to live in isolation, they don't want to mingle around, they don't want to socialize. You have to look after those. That it's also a sign of frailty. And sometimes it's hard for them to live with a family in a house. And they have to go up the stairs, and they find it hard to go in and out, and they are having a hard time living in a house or a family environment. They have to move to a care home, and people who are living with them, it starts stressing them out as well, and you have to look after that as well. And in our hospital, we have a tool that we look after that we call clinical frailty scale, and we have photos attached to it. The different stages of weakness or frailty that you can categorize. If you look at 1 to 3, and if you look at with the aging and people who live alone, but they walk every day, they go for they're doing exercises, and they can look after themselves, they can manage themselves. And then you have more frailty than 4, 5, 8. Then you look at it, then it's a little bit harder. Doing your average daily activities, you're getting more weak. It's hard to take a shower, cleaning, cooking at home. It's harder. Then they need help with all those things. Then we are going to 6, 7, 8. The people, the patients, they can't do much anymore. They need help, even eating, putting clothes on, and daily activities. They needed help. Why is it important for us? I just wish to make a point here. As I said earlier, when I look at it, some people, 70, 80, they are very frail, and they need help. But I also look at it, some people are 90, 95, 100. They're still in 1 to 3 level. They're still living by themselves, taking care of themselves. If you look at a person who's 70, and you look at that person, some people might think they have flu, and they have illness, and they're 70, 80. It will impact them because their age isn't that much. But that's not the case. If you are feeling more weak, more frail, the person who's 90 and healthy is not too weak, he can manage the stress better. Age is just a number. You don't need to emphasize that much. If somebody is aged and healthy, but if you are frail, you need to look after that.
So, frailty, what are the consequences of frailty? So, one thing that we know, people who are frail, they have the risk of falls. And when you age, you fall. For us, it's very risky for us, because then we know that you have to go to the hospital, and more likely you will break your bones, and it's hard for you to recover. As you get more frail, then there are severe risk, and then there will be a premature death. They will have to go to for surgery. People who are frail before surgery or after surgery, there will be like risks, difficulties, and hard to recover for them. So then some people have the need of a gallbladder, or if you are already frail, then you can't handle the surgery well. Sometimes when we think something is minor like flu, as I told you earlier, for last 2-3 months in the hospital, there are many patients who are coming end up in the hospital just because of the flu. People who need patients who need the doctors. It's not about age, it's about frailty. Okay. As I told, when people think what is fall, we all know that if you if fall is an event which results in a person coming to rest inadvertently on the ground. Some people say that when I'm walking, I can't put weight on my legs, I'm frail. When I stand, I can't sit well. While I'm sitting, I can't stand, I just go down. So we shouldn't ignore all these things. You should talk to your doctor about it. So now I talked about frailty, what you can do, but once you start getting frail, the most important thing is how we can manage, how we can treat, how we can delay it. It's not only about one person. And then it's not that you come to me and I will treat your frailty. We need a multi team approach so we can handle your illnesses. If you have diabetes, heart disease, how you control these things. So doctor has one role, but about activity, balance training, all the other things, you can work with the physiotherapist, your home setup if it works for you, or like there should be handles in your washroom, it should work for you. In your hallway, there should be handles installed so that then you can work with occupational therapist. They can come to your home and they can assess what they can do for you. If you have poor nutrition, protein is very important. You should increase your protein intake with the help of dietitian. Vineet Sidhu will talk about it. She is a dietitian. How you can avoid, how you can deal with the frailty if your cognitive and mental health gets affected, how you could deal with it. You can talk to the dietitian. Dr. Jane will talk about it. If you have lot of medication, you can talk to your pharmacist and your physician. You can share with it. So we will talk about that also. In the summary, the most important thing that you can do now, so if you are frail, or you can you can be proactive about frailty. To the first thing you can do is monitor your blood sugar, blood pressure, cholesterol, monitor it, talk to your doctor. The second thing is maintain balanced diet and good eating habits. The third thing, which is really important in my mind, stay active, walk, exercise daily. And if you are using substances, if you smoke, drink, and it affects on aging, so we can if you can quit, it will be wonderful. And your personal interests, develop your personal interests and hobbies. people who are living alone make social connections, so usually the mental health gets affected for those people who live alone. So so to become healthy, stay connected with your doctor. These are the sources in the packages. These are different websites. You can get information from all these websites, and I will answer your questions later on. Yeah, so I'm waiting, looking forward for your questions. Thank you. Okay, we start questions. First one is about bones and joints. Is for Dr. Sohi. Two questions. If your bones start growing, what you should do? The second is, if in your joints or in muscles, if there is stress or breakdown, what are the regions and what can we do for that? First of all, we talk about the bone. When the bones are weak, frail, we can see with the test. It's called bone density test. When you do bone density test, if the bone is weak, there is a level. First level, we call it osteopenia. So where we live, there is not enough sunshine. There is a vitamin D deficiency in the community. Where if there is a deficiency calcium, vitamin deficiency, vitamin D deficiency. So the first step is you uh, you should increase calcium and vitamin D to protect your bone. So if they are more really frail, when you reach to the stage of osteoporosis, that means in the bones you can think about they are rotten, they are very frail. Then for that you have to take tablets and other medications that can help the maintain the bone or regenerate the bone. And so you should, if they are going down, bone density test, talk to your doctor. So he will, if you are on the first stage, if they are really weak, vitamin D and calcium is needed. You need a prescription for that, and we can help you with that. Whatever can you do to protect bones? Exercise. That means which exercise? Yeah, so the one that can stress your bone. Walking is good for your heart, for your breathing, but it doesn't do anything to your bones. So the exercise that were shown, and they will show after in the afternoon for your bigger muscles. If you put some load on those big muscles and bones, so that's how you can address the frailty of bones. The second question about the joints. As you age, the the joints, our joints, and it's common. Arthritis is common problem in our joints when we age. It's called osteoarthritis. When it starts, for that arthritis, we can't do much with that. But the joint and the muscles related to that joint, up and down, or for example, your knee or your shoulder with arthritis, you have to make your muscles strong, like your shoulder muscle, your arm muscle. You can decrease the pain with, you can lower the pain. You will not need that much medication for that. You can apply creams that lower the inflammation. You can lower the pain with the creams or exercises. Sometimes when the pain is severe in the joint, then we have to replace the joint with the surgery. So in the early stages of that pain, we can refer you earlier. When the pain is severe, then you make a referral. Then waiting list is long. The surgery takes 2 3 years. Then the frailty kick in, because you are not using that joint. So who are not walking that much because the knees hurt or your muscles are weak, then so what can we do with the muscles? You ask this question. Exercise, as I told you earlier, and protein in your diet. So these two are the main important things. If you are 70 kilos, if you are 90 kilograms, so the minimum you need is the 70-gram protein in a day if you are 90 kilo. So more protein you take, your muscle, it will help your muscles. When you exercise, your muscles get a good stress, and with that they are strong, and with age they decrease, and we can stop it from progressing. Next question is, unnecessary bone growth is the same mechanism like arthritis. When your joints, when there is a breakdown of calcium and calcium deposit in your bone, whatever space there should be is called grease too, is fluid in the joints. When that fluid is nice and smooth, and then it's the joints are spinning nicely, but when that extra deposit is there, then they are not that smooth, and then it doesn't spin or move nicely smoothly. So to stabilize the joint, those bones, you cannot remove it until there is a surgery, and the muscles around it, you can make them strong and you can stabilize the joint. So the issues in the joints is usually gradually increase over the years. In the beginning, you are exercising, stabilizing the muscles, that will strengthen your joints. Your question, you want to ask more? Lunchtime, Gurmeet Sohi will be around. You can ask her that time. Any personal question you are asking, remember, she's not your healthcare provider. So they have a license. Everybody has a professional license. She has a license. You can ask general questions. Don't ask liability questions. So especially some of the things we can't answer. We don't have your history. Please remember that. Your family care provider can tell you most of it because they have the history. We don't. We are not your healthcare providers. Please ask questions, but general questions. There are line of questions. You write your questions. You can write your questions. Please write. There is a line.
1200 milligram calcium in a day that you can take. Some people take calcium pills. It's fine if you're not getting it as part of your diet, but that can create constipation. But otherwise, you can take 1200 milligram calcium vitamin supplements. If you're not aged, but you're still not getting a lot of sunshine, you can take 1000 unit of vitamin D. If you have a kidney disease or knee disease, that your calcium intake is different. If you have kidney disease, it can be different. You can ask your doctor about that. Next question is about social work. You're representative of social work. Both questions are same type. They want to ask, if somebody's in your home, they need a placement, they need a care home, and you can't look after them, how to do it. Can you help with that? If you can help, how to contact social worker. There's some information that was provided in the package as well. Bone Health Service line, you can call them in the Fraser Health if you are in the Fraser Health area. And they'll do an assessment. And they'll look at that if your family member is suitable for a nursing home or available for home sport, if that facility is available or sources. And usually they start with that. And if that is not helpful, then they look at a facility if you qualify for that or not. But it's also that worth looking at if your family member is, if they want to go into a facility or not. Because if their memory is still good and they don't want to go, you can't really force them to go there. As my mom's condition was, she would never go to a nursing home, even in her last days when she knew in hospital that my health is not well, that perhaps I have to go to nursing home because it will be really hard at home. And then she just lost her courage. Even then, we tried to convince my mom that we are not able to care for you and you get tired as well and there are so many responsibilities, but she didn't want to go to a nursing home. Then we couldn't force them. But if mental ability and your memory is losing and the doctor is saying that this person cannot make her own or his decisions, and you are unable to care for them, then they can decide which care home is better for them. You can talk to your doctor or home health care. Next question is for me. And people who are here on super visa, can they see their pharmacist or prescription? And let me tell you what super visa there's a clause in your super visa insurance if you know somebody, and read that clause. If you have a BC Care card, and even in a super visa, if you have a BC Care card, those resources are available to you, which are available to BC residents. If you go to see a doctor, there's a fee available that you have to pay. If you need to ask questions from your pharmacist, and if about the medical review, if that's covered or not, perhaps it's not covered if you're not a BC resident. It depends on your care card, and it depends on your MSP. Right. Next question. It's the same. Again for Dr. Sohi. Dr. Leena Zain is not here. Dr. Sohi will help us. 2 questions. First of all, if you can tell again, dementia and Alzheimer, what's the difference? And if you spend more time on the phone, and can you get dementia? First question, if you think dementia is a general category, and dementia has many types, Alzheimer is a type of dementia. If you have Alzheimer, that means you have dementia. And some people might have dementia, but it's not Alzheimer type. It's different. Dr. Jane explained that. If you have stroke and your diabetes, sugar, and blood pressure problems, it affects your brain differently. And it can decrease your thinking or cognitive abilities, vascular, and if you're Parkinson, you can have dementia due to that. There are different types of dementia. Alzheimer is usually short memory, what happened today, yesterday. You start noticing that earlier. When you see geriatrician, you ask them many questions about thinking, about your family, what they saw, and then you do memory tests, and then you can figure out what kind of dementia you have, Alzheimer, or any different kind of dementia. Some people have it mixed. In our community especially, have diabetes problem, heart, stroke. And some people, Alzheimer, vascular, they get the same, that dementia at the same time. And when we see you, we can diagnose that and what to do next. The next question, that's a very important question, that our phones, TV, when you look at it, when you're sitting, you're not actively using your brain. YouTube, WhatsApp, videos you're watching. As you're aging, I'm not saying that it can lead to dementia for you, but it's a risk factor. Because you know two things. There are two things that can decrease dementia risk, hearing and medical issues. One is exercise. If you do exercise and your brain cells are fine, they remain strong. Other is socializing. People who spend too much time on the phone and they don't pay attention to new interest, and that starts the weakness of the brain. It starts faster. If I can say, exercise is really important, and to learn new things. And if you socialize, see other people, you talk to them, you learn something, and you use that brain in that setting, there's no comparison to that. So use the phone the least amount of time, watch TV the least amount, go for a walk, exercise, spend time with friends, family, kids, and spend more time with them. It's beneficial. Next question. We have only a few questions. I know we have lunch coming up, so we can eat. Next question is pharmacist. I can answer that quickly. Question is how you can arrange a meeting with pharmacist. The pharmacy that you go to, you can book an appointment with the pharmacist there. You can talk to them about your medication. And the pharmacy that you usually go to, where you get most of your medications, you can make an appointment there. And I'll be here at lunchtime. You can ask me personally. And if you have allergy with the changing seasons, antihistamine or allergy medication, can you take? Can you take it all the time or as needed? You can do it both. If you have allergies all the time, you can take those allergies medication. But which medication you should take, you should ask your pharmacist. Some medications that can increase your blood pressure, your sugar level, make you sleepy. Which antihistamine you should take, you can ask them what conditions you have and what's the best for you. And if it doesn't help, there are prescription medication available as well. You can get it from your doctor. Yes, you can take it, but just be careful what interaction. Next question, the last question is for Sir. What is Taxi Saver and how you can get it? Especially here in Lower Mainland and in other areas, the service might be different. Taxi Saver program it's through Translink. You have to register. It's called Handy Dart. There's so many coupons available that you can get a taxi at 50% off. There's Handy Dart, that's buses. Then you go to the appointments, and they're available for you in the community services. And if you want to go socialize to go make an appointment, and there are tickets available. Taxi saver program, you can get the coupons from Translake, but you have to register with Handy Dart, and you can use it for 50% rebate at the taxi fare. And Handy Dart has many criteria as well, where you can't use the public system, or you can't walk or sit, or you cannot use the normal public system, and you need that service. It's not available to everybody. And I'll just give a couple more suggestions. Secondly, if we have serious illness and we cannot look after ourselves, or the person we are looking after, you are unable to do that, there are many financial benefits available through there's a disability tax credit, and you can get an application through your doctor if you have illness like that. And I just want to give you a suggestion at the end. And right from the beginning, we have so many stressors in life. And now the counseling services are available. And like moving forward, there's a organization available. They give you free counseling or for lower pay. And there are many other services available in the community. I'll encourage you. And, we also need counseling. Sometime in the family, there are so many stressors in life, in our family. And to look after our health and to seek help is also important. Thank you.